The first one is about anything that you have been able to do to prevent people from requiring intubation, being on a ventilator. For example, the antibody to the interleukin-6 receptor, I think it's called tocilizumab. I've read it on the China, the National Health Commission website, that there have been studies going on, and also that on March 3rd, the 7th version of the National Health Commission guidelines for NCP, for diagnosis and treatment, it said that if the patient is severe or critical, that you can give them this antibody against the interleukin-6 receptor. Are you doing that in Shanghai, in your hospital?
You mean the antibodies derived from those recovery NCP patients?
No, I mean the monoclonal antibody that it's called tocilizumab. It's against the interleukin-6 or IL-6 receptor, and it's made by a company called...
I see.
Okay.
I see. IL-6 receptor antibody, monoclonal antibody. Yes, I have one patient in my ICU ward who used this Tuozhu monoclonal antibody, but the effect is not so well. The patient died. So in my opinion, this coronavirus infection usually causes the inflammatory storm, and this inflammation will cause damage of alveolar and the other organs, for example, heart and kidney, and this inflammation storm can only be inhibited by the steroids, for example, glucocorticoids. And we usually treat these critical ill patients with the combination of glucocorticoids and intravenous immunoglobulin. And because all the people in the ICU is critical ill patients, so they need multi-organs life support. For example, mechanical ventilation, and the intubation rate in my ward is almost 81%. And also the CRRT, even the ECMO, and VV ECMO is the most used mode, and VV ECMO is usually used for those people with respiratory and cardiac dysfunction patients. And because the high coagulation, the high risk of venous thromboembolism, we usually use anticoagulation therapy, especially prophylaxis anticoagulation therapy for those patients. And because of the infiltration of lung tissue and also the damage to the heart, so we usually use volume limitation method to diminish the infiltration, the lung infiltration, and the preload of heart. And for those people, recovery from the coronavirus infection almost 1/3 of those patients have pulmonary fibrosis. So we usually use anti-fibrosis regimen for the treatment of those people. And the regimen is a combination of glucocorticoids and N-acetylcysteine and pirfenidone. Those patients treated with these 3 drugs usually recovered very fast and shorten the duration of hospitalization. The patient, when use these 3 drugs, 1 week later, when we check the CT scan, the most shadow in the CT scan of patients' lungs will dissolved. Most of them will dissolved. So I think is a good regimen for anti-fibrosis. And the last method treatment for the critical ill patients is pulmonary rehabilitation. The pulmonary rehabilitation is very important for patients to diminish their symptom burden, their usage of oxygen, and it will shorten the duration of hospitalization dramatically. So this is my opinion for the treatment of critical ill NCP patients. So now, until now, 15 patients were withdrawn mechanical ventilation, and 3 patients were withdrawn ECMO, and we have 10 patients dismissed from the intensive care unit. So I think is good results for fighting 1 month fighting.